Surgery is a big event, but you don't have to go through it alone. University of Missouri Healthcare is reinventing the way surgery and patient care is delivered. It's called Team Integrated Enhanced Recovery, or Tiger Protocol, and it's the newest innovation in surgery treatment at MU Healthcare. Healthcare professionals at every level are coming together to develop a collaborative approach for patients and their care.
Our goal is to have the healthiest population in our state and to make our state the healthiest state in the country. And we think that this is a very substantial way which we can try to achieve that goal.
Tiger Protocol is a surgical standard where the patient is a primary partner in care, personalized care tailored to each patient, a distinct team approach that involves surgeons, physicians, nutritionists, physical therapists, anesthesiologists, and nurses. An approach that pairs each patient with a nurse navigator to guide the patient through his or her surgical journey. The end result? Patients who, after surgery, get healthier faster and who are able to return to their lives with fewer complications.
The entire patient is considered from the very start of their treatment, taking into consideration what their nutritional status is, what their physical abilities are, and then also preparing the patient psychologically for what they're about to go through. And it's really looking at a patient as a whole entity and all their needs.
And what we do is we describe a surgical journey, and perhaps the most important thing that we've done is to work hard to get all of the clinicians and the providers and the hospital support and the nurses on the same page, so we're telling the patients the same thing.
So all of these people working together and that you get to meet before surgery, throughout your hospitalization, and then in follow-up post-operatively. That gives the opportunity for the best outcomes for you and the best satisfaction for everybody involved.
It used to be kind of race to the operating room. Everyone's apprehensive about the new diagnosis of cancer. I need to have surgery yesterday. But what we've learned is if we pay attention to improving the ability of the patient to get through surgery, they'll do better with their recovery. They'll return to normal function a lot faster and in a lot better condition.
Tiger Protocol's focus is on helping our patients to be well prepared for surgery so they'll do better during and after surgery. At the beginning of the process, each patient receives a surgery supply bag. The bag provides informational handouts, contact sheets, and tools to optimize patient care before, during, and after surgery.
In my mind, one of the most important things in that bag is an educational binder. It has every contact, all of our phone numbers, if you have any questions that do arise throughout the process, but most of the information to walk you through what to expect, what your surgery itself is going to entail, what your family should expect during the time that you're in the operating room and in the hospital, are all in that packet.
Doctors at MU Healthcare make it a priority for radical cystectomy patients to know what to expect before surgery, and we'll walk you through the process step by step before the procedure.
Invasive bladder cancer is a very dangerous disease with a high risk of spread. Surgical removal of the bladder, a radical cystectomy, is the preferred treatment when you consider the effectiveness of curing the cancer.
The surgery itself takes up to 5 hours to complete. Your family and loved ones in the waiting room will get updates throughout the surgery from your nurses. After surgery, you'll be moved to a recovery room and then to a more permanent room in the hospital. While in the hospital, you'll be visited by a wound nurse, pain nurse, dietitian, physical therapist, case manager, and other care team members who will teach you how to care for yourself after surgery. Your doctor will meet with you to discuss your progress, and the care plan will be updated daily to meet the goals of your recovery. Patients are encouraged to get out of bed with the nurse's assistance the first night after surgery. Walking is one of the best things you can do to speed your recovery. Drinking plenty of fluids will help with your recovery. You can refer to your educational binder for more resources on what to expect during your hospital stay. Before you're discharged, your care team will ensure that you can tolerate a regular diet, your bowels are working correctly. They'll arrange a follow-up visit with your doctor. They'll help you understand your pain management plan at home. You'll receive prescriptions for new medications. You'll understand how to care for your surgical site or wound. You'll know who will be picking you up from the hospital.
Most of our patients return to baseline of function within about 3 months. My favorite story is of a patient who was able to go scuba diving about 3 months after their cystectomy.
Doctors and anesthesiologists at MU are also using new techniques to manage pain in post-operative patients.
Narcotics make patients sleepy, they slow down their intestines, they can make them nauseated. There's a lot of problems that narcotics can induce that will really slow down a patient's recovery. So now when I'm talking to patients, I explain that our goal is not to make them pain-free. We need to manage their pain. A lot of it is reassurance. It's normal to have a certain amount of pain after surgery because you've had an incision and it's nothing to be frightened of. But we need to manage the pain. The difference that I would see in my patients post-operatively between the anesthetics that we're giving now and the anesthetics that they used to get is profound.
One that definitely comes to mind was an 85-year-old Whipple operation. Seeing him up in the chair, saying he has no pain the night of the surgery, talking to me in a normal conversation, not knowing he just had a 12-hour operation, drinking fluids, getting up and back and forth from his bed to his chair with assistance, that will forever be in my mind as to why we're doing what we're doing.
With Tiger Protocol, patients encounter fewer complications, are less likely to be rehospitalized, and most importantly, they recover sooner, returning home to more quickly resume their lives. Tiger Protocol assures you're never alone. You have an entire healthcare team working with you and pulling for you every step of the way. It's a team of experts harnessing the latest in technology, innovation, and research, and delivering that knowledge and expertise to patients with a caring approach. MU Healthcare's Tiger Protocol, reinventing care, reinvesting in you.